Hi, I'm Dr. Julie Steinauer, and in this episode of Ask Dr. Julie, I was asked a question recently online, probably on YouTube, of whether or not we can help someone who has congenital strabismus. And the answer to that is yes. But first, let me talk to you about how you can connect with us. If you're local, you can call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. You can either fill out a questionnaire or click schedule a consultation and then schedule a consultation direct with me. Now, to go back and talk about whether or not we can help out with congenital strabismus, the answer to that is yes, we can. And so congenital strabismus is just meaning it was there pretty much early on, almost like from birth or shortly thereafter. And whether or not that is something that was, due to some sort of trauma in the womb or the birth process or some sort of, you know, genetic familial thing or, lack of oxygen, who really knows on that one. But whether it is congenital or whether it is an acquired strabismus, there are things that we can do to help. Now, in acquired strabismus, that just means that it came on, after birth, sometime later on in life. And seemingly, if it came on maybe in adulthood or later in childhood, we would want to look at what is it that potentially caused this to come on. Was there some sort of stress? Was there some sort of problem? A sickness or illness or something that could have potentially been the trigger to this. There's lots of things that can trigger acquired strabismus. We do want to make sure that it's not something that could be an indicator of something more serious, that we would want to dig into and find out if there are any other neurological problems or signs or headaches or other things that could indicate something more serious going on, or maybe even like a stroke, or in our older patients it could be something like Parkinson's, or some sort of neurological problem that they might be having, or MS. So whether it's acquired or whether it is congenital, yes, strabismus is something that we can do something about. Now, let me talk to you about how we do that. In tons of my videos, probably my favorite thing ever to really talk about is Syntonics goggles. Okay, so the first thing that we are going to do is we're going to use Syntonics filters or goggles, sometimes I call them, but this is light therapy. We're going to use that to trigger the brain to tell specific muscles how to realign themselves. So there are filters that kind of trigger the muscles of the eyes to realign more appropriately. Now, depending on how big of an angle it is, this might be something that you notice like, wow, benefits from immediately, like within weeks. Or if it's a really large angle, it might take longer. And you may notice some inconsistencies, like some days it's really good. Some days it's like literally awful. Okay, it just might bounce around as the brain is kind of starting to learn how to signal the muscle appropriately to align the eye. Now, we don't just do the Syntonics. Okay, we do other things besides this because there's a little bit more of a hands-on or more action-oriented approach, which is the second part of the program. It's kind of like a two-tiered approach or a two-prong approach, one being the light therapy and two being the vision therapy, which is a little bit more hands-on and more kind of physical action, where you might be patching an eye and learning to track or focus, or learning to stretch the eye over to certain areas if there's a restriction, or if an eye kind of tends to turn in and the muscles are being pulled really tight. So there are two halves to the program that are really, really important. And we're going to use those two things to help people learn how to align their eyes by teaching the brain what to do to signal the eyes appropriately, and then giving you a lot of activities that you're going to be working on to train the brain to align the eyes, use the two eyes as a team, not allow the eyes to shut down or turn, and then also to develop depth perception. And I also want to just add that really doesn't matter what age you are. So obviously this video is talking about congenital, so we're talking about young children, babies, infants, toddlers, that kind of thing. babies and infants. Anyway, so we're talking about young kids, but we want to also always just point out that age is not a factor. You can actually have improvement with your strabismus at any age. Now, if you like the video, hit the like button. If you have not done so, subscribe to our YouTube channel. Hit the bell icon so you get all of the notifications. Obviously, pass this information on, but to connect with us again, call us if you're local at 618-288-1489. If you're not local and you're somewhere else in the world, we could maybe help you out depending on what's going on, and we could maybe work with your doctor. So give us either a click of the button to schedule a consultation on our website at visionforlifeworks.com, or you can fill out a questionnaire for us, which will kind of bump over to us, and then we'll start the process of emailing with you. Thank you.